Welcome back, and thank you for watching WKNI. And today we have the CEO of Andalusia Regional Hospital, Brother John Yangs. And John, you moved here from Ohio. I bet you're glad to be in the South tonight.
Very much so. Thank you, Bob. Appreciate
Did it ever snow in Ohio?
Just a little bit.
Just a little bit?
Yeah, I actually spoke to my wife this morning. It was 20 degrees in Columbus, Ohio.
Oh, bless her heart. You have 3 kids, don't you?
3 kids.
One's the 4th generation at the University. I wore my Florida at the University of Florida in Gainesville, Florida, Southeastern Conference. You grew up in Florida, didn't you?
Did. Our oldest son, Chris, is in Gainesville and graduating from the College of Architecture.
Wow.
And hopes to stay there for graduate school, but he has looked at a couple other schools in the Southeast. And I'm from West Palm Beach.
Right.
And my wife's from Orlando.
So y'all were born in a nice warm climate and had to move away and get your wings and learn how to be a great CEO, and now you're coming down here and you've got some great ideas to improve what we already have. We've got some good building blocks here, don't we?
It's really what I would consider a legacy of caring. You know, next year, April of 2016, Andalusia will be celebrating 50 years of that it opened its doors at its present location.
You know, I'm 65, and I can actually remember as a child, I can remember George Proctor and some of the original board of directors, and I remember the ground. I remember that it was basically a dairy farm out there, and everybody thought, why are they putting it way out there? And now it's just right in the center of town.
Absolutely.
And what a wonderful campus you have out there, and what a fine, clean facility to get excellent service. You don't have to go out of town to get good service. You have many specialties out there.
Right. And Bob, that's what I've been impressed with. There's just a very welcoming, great group of folks there, hospital employees, the volunteers, certainly the medical staff, and excellent clinicians. And you mentioned the specialists, and certainly there's some needs that we still have in the community, and that's what I like to see. I like to see some specialists that we can complement the physicians that have been in our community and have served the community for several years. So I think that's where we have some opportunity, and really being able to care for our residents closer to home, because healthcare is delivered locally.
You know, you mentioned your employees. How many total employees do we have at the hospital?
We have approximately about 300 employees there.
That makes you one of the largest employers of our area.
Correct, absolutely.
And they're most of them are real jobs too. I mean,
they are, and you're dealing with. I think hospitals are fantastic in the sense that you have very highly educated individuals and opportunities and jobs for those folks, but also you have entry level positions, and so it really can accommodate the full array of folks in the community. And usually hospitals, given that you have the nurses and the clinicians, the average wage is higher than the average wage in the community. So certainly it's a good economic engine to have in our community.
You know, it's so welcoming to have you in our community and to have your perspective on hospitals in general. You know, some of the people that have worked there their whole lives. You hadn't had a great turnover in local personnel. Some of those people have been working there a long time and doing a good job.
Absolutely. 20, 25, 30 years, it's not unusual.
And that says a lot about the atmosphere out there. If an employee feels like hanging around, and they feel like it's safe for their family too, don't they?
Absolutely.
I mean,
yeah. And it's our employees, it's our employees, but it's neighbors taking care of neighbors. And and that's one of the advantages of living in a smaller community.
You have quite a large medical doctor staff. I mean, they're probably, how many doctors?
Active physicians, we have over 25, 30 physicians that are actively there at the hospital continuously.
Right. And you have specialists like Dr. Price is a cardiologist.
Correct.
I had the pleasure of meeting him and his family this Christmas, and what a wonderful person. And then on a personal note, he's actually seen my father-in-law, my mother, and now John Jay and I. So he's picked up 4 customers since he's been home. But he's serious about his business.
Well, I guess if you're working with a cardiologist, you want to be serious.
You probably don't want me working on your heart, is what we're trying to say. But he's a great guy, and his family. And He brought, two sons with him, and you've got a family. You're actually helping our community to grow.
That's right. Absolutely. And my daughter will be moving with us. She's 14, so she'll be a freshman at Andalusia High, most likely.
I saw where your other son was thinking about going into sports management.
That's correct.
Well, Troy University is one of the best in the country, and it's just right up the road. And I didn't know if you were familiar with Troy, but and also Judson College in Montgomery has got a good sports program also. So we'll get him to look not just at Cincinnati, but we'll look around the South too and see what's available.
He's done really well in school, so he's had some choices, and that's a good position to be in.
And I know I read in the article in the Andalusia Star News, and it was a great article on you, and that you're interested in wellness.
Absolutely.
And how does that merge with the hospital?
Well, I think hospitals have evolved over time, and historically it's been really about sick care. But I think that I believe that hospitals have transitioned with a lot more focus on wellness and promoting wellness throughout the community, and helping to keep your community healthy. Understanding what some of the unique illnesses are within that community, and trying to promote greater activity, better nutrition. And so I think we have some opportunities there. I'm really impressed here. We're driving into town early in the morning. I see some folks out walking and with their headsets on, and that's great to see. And certainly the hospital can work more with some of the other organizations in the community to make sure that's promoted.
Well, one thing, the next project for the city of Andalusia is South 39th Street, and they're going to continue the sidewalks all the way to the hospital. So you'll actually be able to walk from the hospital to the Winn-Dixie, which is probably 3 miles. That'd be a good walk there today.
Absolutely. I'm glad to hear that. That's
going to be beautiful. That's going to be a beautiful avenue when they are finished, and rightfully so, because it's actually driving right up to one of the largest employers of our county.
That's right.
Isn't that nice? And tell us about some of the specialties that are located there. I know we have radiology, and we have when I go out there, that end of the hospital is busy all the time.
We have in the imaging department, which includes radiology, mammography, CAT scan. We have a 64 slice CAT scanner, which is really top-notch technology, MRI unit, which supports other services there in the hospital, particularly the emergency department. And that's one area that has experienced significant growth year over year. We have a great team in the emergency department that really I consider it our front door. Sometimes folks walk into the emergency department because they need care, and that's the only part of the hospital they see. So having a good radiology department is going to support a good emergency department.
Right.
So that's an area where we've seen a lot of growth. And so, as you mentioned, cardiology supports the other physicians, and so we're looking at what specialties do we need to continue to bring in, looking at our current medical staff, what can we support, what's feasible for us to support.
Well, Dr. Mike Wells was my best friend growing up. Our yards joined each other, and so we got to talk about having children, about his end of the field. But we've got a great place to have a child, have a birthing area, and a separate wing just for that.
Obstetrics, and unfortunately, fewer and fewer hospitals are still delivering babies, and because when you look at it, it is an expensive service to have, but I believe is a much necessary service to be able to continue to deliver, and sometimes you have to take a loss and make it up in other areas to be able to provide a vital service to the community.
Yeah, I imagine that end is pretty expensive because it's really state of the art, and you have your own private room basically to have a child in, and then you've got all the nurses and everything to do with having children, emergency care, and everything is right there.
And that's an area that we're looking at. There are some enhancements that are needed in obstetrics. Patient rooms are a little tight, but so we're looking at what can we do to better accommodate and meet the expectations of moms today.
What about as far as ambulatory services and non-ambulatory services? Did you have all that located inside the?
Absolutely. Outpatient, as with most hospitals, is one of the fastest growing areas because technology is allowing us to deliver more and more services on an outpatient basis. So that's certainly an area that we see continued growth.
How many rooms do we have out there? Do we utilize all 3 floors?
Yes, all 3 floors are being used.
And so you have a lot of rooms in.
Yeah, our average census, sometimes last week we were up into the 40s. This week we're in the mid 30s. So it's a good volume of patients.
And then you have a tremendous amount of services for having all those scopes. We won't talk about where they scope you, but
yeah,
you got all that. Dr. Dayton and Dr. Wells do that every day, don't they? All day long.
Well, there's certain talk about wellness. There's certain preventative care.
Preventative care. Thank you.
That folks should have when you hit certain milestones. Certain birthdays come along with certain presents, and so you got to make sure that you follow through with your doc and make sure that you're getting that preventative care done.
And we would not be doing our service if we didn't talk about the cafeteria. I'm telling you, the food's great out there. It's relatively inexpensive, and the service is great, and you can be proud of your wellness part of your cafeteria. They don't just, they give you the proper portion of the proper food so that you can eat sensibly, but very delicious food.
There's some great folks working back in the cafeteria. I was talking to a couple of ladies there, and they take a lot of pride in what they do. Absolutely.
Well, did we miss anything talking about the hospital?
Well, I think we covered most of it. I appreciate this opportunity. I think that the hospital certainly, we have some challenges, but we've got some great opportunities, and hospitals are a great economic engine, particularly for a community this size. We do pay taxes, to the tune of almost $900,000 a year. So that certainly supports our local schools. And I think hospitals also as participating with health plans such as Blue Cross and Medicare bring revenue into the community, and that's revenue that's not currently circulating here. So it certainly it serves as a great economic engine.
Well, we thank you for joining us, Brother John Yates, our CEO of Andalusia Regional Hospital. And I tell you what, I think we better come back and do another short section, talk about a few more things that are going on out at the hospital. We're going to take a short break, and we'll be right back.
Thank you, Bob.
Hey, thanks for watching. And I'm here with Brother John Yates, the CEO of Andalusia Regional Hospital. And we were talking earlier about healthcare and shopping locally. We're all about our little small television station here about shopping locally. How can we shop locally for healthcare?
Well, I think that certainly the hospital has to earn the support of the community, and how we do that is delivering high quality care, high quality clinical care, and providing it in a safe environment. And Bob, some of the things that we're doing, for example, I mentioned the emergency department earlier, where volume has continued to increase. Last quarter within LifePoint hospitals, we were top in our tier of hospitals, and that is based on some key metrics that they have to meet as far as delivering care on a timely basis. One of the areas that we hope to take the emergency department is to become a chest pain certified emergency department.
And that's just critical as we demographically change birthdays.
Absolutely. Heart disease is still one of the top killers in our country, and so in order to address that by becoming a chest pain accredited facility, there is several hundred standards that we have to meet. And that's based on clinical competency, the way that we deliver care, the timeliness of delivering that care, and the key there is detecting heart attacks early, and promoting that awareness amongst the general community of the warning signs of a heart attack, and so that we can look out for each other. And certainly we're there when you need us, but having your wife or a neighbor being able to detect when a heart attack is occurring is absolutely key.
And if you even think that you are they got a way to find out. So you probably want to come on into the emergency room.
Absolutely.
And they will welcome you. And if you're not, it's not embarrassing not to have one. It's just a fact of life that you had something else.
It's going to happen.
But I mean, if you think that you are, then you might want to go ahead and come on in. And they've got what you need to. They have all the equipment right there to look after you.
And technology is allowing us to do so much more, and that's one way that we can detect disease earlier, and being able to bring resources into the community that normally it would be very difficult to get. So it's making it a lot more affordable to be able to provide that care.
And it's nice to know that LifePoint is the corporation that owns the hospital, and they're trying nationwide to do something that you really couldn't do on a smaller scale.
It is.
That brings a bigger piece of the pie to Andalusia, is my point.
Absolutely, and that's one of the things that LifePoint is stressing within its hospitals. The expectation is that you will continue to develop high quality, safe clinical services, particularly in the emergency department, and becoming chest pain center of excellence and certified is one of the initiatives that the LifePoint is really promoting within its hospitals.
And as a CEO, you come here, you actually expect to raise the bar. You're trying to improve our health care for this huge community. It's not just Andalusia, but it's several miles out. And it's so much more convenient to come to Andalusia than it is because your family's here, you work here, you don't have to take time off, and you're going to have really excellent service in a local, convenient location.
Our mission is to make our community healthier. Very easy to remember, and that's what drives us, is how do we keep care local and make our residents healthier, and really position the hospital to serve this generation and future generations. Again, celebrating 50 years of service is truly a legacy of caring.
50 years, you and TV cable and who else?
The community college.
Yeah, the community college. Wow.
Something was going on between 65 and 66, right?
Something was in the water back in those days. Well, Andalusia was at a critical point, and it could have gone either way. And we're grateful that every one of those things that you mentioned have actually grown and improved in the last 50 years. And certainly great to have the community college here. And it's wonderful to have a hospital of that caliber in our neighborhood. And did we ever talk about physical therapy? Y'all do physical therapy out there, don't you?
Physical therapy is certainly another service line that we have, and it's there to strengthen folks after perhaps orthopedic surgery or a stroke. We are looking at cardiac rehab, which is a service line that we need to develop, and once again, that is progressive care, making sure that once you have your surgery, the physical rehab that you need can be provided locally.
What's nice is it's really a medical center because you have drugstores and you have doctor's offices surrounding your campus. And then if you need testing, you just go right across the street and go and get your test done. Whether it be a sonogram or an x-ray or blood test, whatever it is, the test, you've got all the laboratory and all the testing equipment that you can dream of there.
Andalusia is small enough where you can get around pretty easily, but certainly having a central location where you can drive and park and get your care, see your doctor, and have the ancillary services done right there is certainly a convenience factor.
Well, I know I'm thankful as a patient, and I'm thankful as a member of this community to have you here. I want to welcome you to Andalusia, and I want y'all to, if you have any needs at all, just go look around. They'd be glad to help you, won't you?
Absolutely, and I certainly hospital CEO, but also neighbors. So look forward to meeting a lot of folks in the community and being much more involved with the community.
They want to be good neighbors.
Absolutely.
That's right. That's what it's all about. So thank you, Brother John, for coming, and thank you for Andalusia Regional Hospital, and thank y'all for watching. And shop locally and go to the local hospital.